Hello friends, welcome to Dr. Sai Physiology Academy, DOPA for short. This is a place where we'll make the learning of physiology easy, exciting, and effective. Thank you for joining me. And if you're new to this channel, you're especially welcome. And if you love the content that we share, kindly click the like button and also the subscribe button. Don't forget to turn on notifications so you don't get to miss any new content that we drop. Now let's get started. So today we are dealing with hypoxia and oxygen therapy. So now quickly, what is hypoxia? It simply means deficiency or lack of oxygen at the tissue level. No, in the end, after all is said and done, you've taken in air, it has been transported, you need that oxygen to be utilized by the tissues, by the cells of the body. So it's lack of oxygen. So the way hypoxia is classified, it follows from the different processes by which oxygen is gotten. Okay, so there are basically 3 points that you always consider. It will help you remember the classification. So we are going straight to the classification of hypoxia. You know, there are processes that happen in the lungs. The next place is blood transport. This one is about ventilation. Okay, ventilation and exchange happens here. Blood transport. Then the next place is now the tissues. Okay, where they enter into the cells and they are utilized. So now you ask yourself, what are the different types of hypoxia based on this? If it affects any part of this place, hypoxia can result. Okay, if any of these 3 respiratory processes at these 3 points is affected, hypoxia can result from them. So it helps you to understand it. So let's go right into it. Now, so when this place is affected, the lungs, we call it hypoxia. Okay? Then the blood has 2 types. You have anemic hypoxia. Then you have what is known as stagnant. We'll explain all of that. Stagnant hypoxia. Then at the tissue level, you have what is known as histotoxic hypoxia. Now, hypoxia, it has to do with, first of all, the oxygen tension or oxygen partial pressure. So that means right from the very beginning, there is no oxygen in the atmosphere. Number 1 cause at the lungs. Another thing too, even if there is enough oxygen in the atmosphere, but you have a respiratory problem, for example, maybe asthma, you cannot take in enough. So instead of the normal tidal volume of 500 mils, you know, tidal volume, you're not taking in maybe 200. It doesn't give you enough oxygen in your blood. Do you understand that now? And maybe there's a problem with the exchange, okay, the respiratory membrane between the alveoli and the blood. There's a problem with maybe some pulmonary disease, like maybe emphysema, called emphysema, pulmonary fibrosis. There's a problem with this exchange. Then also enough oxygen will not enter, even if you've taken the 500. The diffusion capacity is affected. So any of those 3 scenarios, hypoxia, because in the end, not enough oxygen is entering the blood. That's from the blood upwards is hypoxia. Do you understand that now? Low oxygen entering the blood. Hypoxia. So the next stage now is anemic hypoxia. Enough oxygen now has entered the blood. But you know, when we talk about oxygen transport, apart from oxygen entering the blood carries oxygen. 97% of oxygen is carried by what? Hemoglobin. So what happens if you don't have enough hemoglobin. Oxygen cannot be transported. Do you understand? The blood cannot carry enough oxygen to all the tissues of the body for utilization. Deficiency of oxygen at tissue level. It's called anemic hypoxia. So anything that will cause anemia causes anemic hypoxia. Okay? All right. Then the next one now is stagnant hypoxia. This one has another name. It has another name. It's also known as ischemic hypoxia or hypokinetic hypoxia. Do you understand that now? Now, what's happening? Kinetic movement. Now, even if you have enough oxygen carrying capacity and all of that, but the movement is carried by the blood. The blood is not flowing well at the normal velocity speed that it should flow to all the tissues. That means anything that is affecting blood flow, adequate blood flow. So you can see that a very good cause of stagnant hypoxia is heart failure, for example. The heart is not pumping blood with enough force to push it to different organs. So that's what causes stagnant. Hypokinetic, that means less speed, or ischemic, they're all the same thing. Okay, then now we go to the final one. Histotoxic. Tissue or cells, toxic to the cells. This one has to do with utilization. Enough oxygen has gotten to the cells. It has entered into the cells. Now use it now. The cells cannot use it. They're incapacitated because of toxins. A very good cause of histotoxic is cyanide poison. You know that cyanide, people usually commit suicide by ingesting cyanide. Do you understand that? Cyanide poison. Cyanide poisoning. Very good cause. That means it destroys the enzymes that are involved in oxidative phosphorylation. You know, the mitochondria is the powerhouse. It's where oxygen is now used to generate ATP. So all those enzymes that are involved in the mitochondria to use oxygen to produce a lot of ATP, it inactivates them. That's cyanide. And the body has enough oxygen, but it cannot use it. There's hypoxia deficiency or utilization of oxygen at the tissue level. So you see the four different types of hypoxia. Very, very easy stuff. Very straightforward. Once you understand lungs, what's happening at the lungs, blood, tissue, very easy to understand. Just remember it like this. All right. So we're going to be now dealing with oxygen therapy. Very straightforward, not going into complicated stuff. How much does oxygen therapy benefit these different types? They don't benefit all the types. We are going to be looking at that after the break. So don't go anywhere after this break. All right, you're welcome back. So let's quickly go into oxygen therapy. Very interesting how oxygen therapy affects these different types. 1, 2, 3, 4 different types. Okay, but now we're going to be looking at it from 5 perspectives. No, 3 here, 1 here, 1 here. Now look at it. Look at it now. Talked about the fact that one of the things that causes hypoxic is low oxygen tension in the atmosphere. There's not enough oxygen. A very good example, maybe in a very crowded space, small crowded space, or high altitude. The higher you go, the less the partial pressure. And you understand that? So in that case, when there's low oxygen tension in atmosphere, ATM, atmosphere, what happens once you give oxygen? Okay, you are giving oxygen, additional oxygen. It absolutely corrects hypoxia. Okay, absolutely. Okay, so the next thing now is, the tension is normal, but you are not taking in enough. There's problem with ventilation. You know, I talked about the fact that maybe in some diseases now, instead of taking tidal volume of 500, you are now taking maybe 300. So that means there's some hypoxia. We're taking 200. Okay? So that one now, there's problem with what? Pulmonary ventilation. How beneficial is oxygen? Now, you can give 100% oxygen. You know, oxygen normally is 21 or 20% in air. But now you're giving 100% oxygen. That means times 5. So even if the person's tidal volume has reduced from 500 to 100, think of which is very rare, 5 times less. When you give 100% oxygen, you have increased it by 5 times. So it's extremely, oxygen therapy is extremely beneficial. Extremely, let's put it here, extremely beneficial for such kinds of problems. Okay? Then another one now is now the exchange, gaseous exchange. You've taken, but there's problem with that respiratory membrane diseases, you know, fibrosis, emphysema, they've been destroyed. Look at now, exchange. You know, we talked about Fick's law, the things that control the rate of diffusion, which determines the diffusion capacity, PAS. Then the thickness, then molecular weight, square. So this one is the pressure gradient. That means between the two sides, the wider it is, the faster it will move. That's okay. So everything here determines the diffusion capacity. Now look at what happens. We are giving oxygen, 100% oxygen with a lot of pressure. Okay? So oxygen now is occupying all the pressure in that gas. So you have very high oxygen partial pressure. Sometimes as high as over 600 and so on. And then, you know, normally the pressure gradient is 64. Do you understand? 40 on this side, then 104 on this side, 64. But now the partial pressure is very high. So you are having a very gradient that is large. So it helps to cover for those deficiencies. So it increases the diffusion capacity that has been reduced by diseases. You know, so in this case, oxygen, so problem with gaseous exchange. Problem with gaseous exchange. All those things I mentioned, pulmonary fibrosis, emphysema, and so on and so forth. Oxygen therapy is what? Highly beneficial. Absolutely beneficial. Extremely beneficial. Highly beneficial. Then in this one now, anemic. Problem from the blood. What do you think happens? Oxygen has entered enough, but you don't have enough hemoglobin. No matter how much you give oxygen, it will not increase the hemoglobin. There's very little hemoglobin. It can only just increase the saturation, okay? But you know that there's normally the saturation is just 95 and so on. So even if you increase the saturation close to 100, it still does not change much. So the real how to solve those people's problem is to increase the hemoglobin. Increasing oxygen does not do much. Okay, so it's of little benefit. It's of little benefit. Then you have anemic or stagnant and so on and so forth. Then tissues now, at the tissue level, if the problem is coming from histotoxic, cyanide poisoning and so on, give all the oxygen you want to give in this world. They cannot utilize oxygen at all. So oxygen therapy is of no benefit at all. Absolutely no benefit. So you see the scenario. So you help you to understand as a clinician. You want to help your patient. When you understand the problem, you know exactly how much oxygen therapy. Not that you see someone that has cyanide poisoning, you want to now be depending so much on oxygen. No, you are doing wrong management, wrong treatment. You understand that now? So this helps you, okay? So the details are in the books. Check the description box. You see the link to soft copy of the book, hard copies, and even where I answered so many commonly asked physiology questions. The links are out there. Make use of it, all right? This is just to break the barrier of understanding for you, make it very easy, exciting, and effective. So I'm going to see you in the next video.